Okay. All right. I will go ahead and get started. My phone is blowing up. Perfect. Okay. All right. Welcome, everybody. Thank you so much for tuning in this evening. I am Angela Wilkinson, and I am the owner and founder of Total Nutrition Technology. I'm here with Dr. Ferris. He's actually going to be taking the lead tonight. We always love the opportunity to spend time with Dr. Ferris and pick his brain and learn all kinds of great information. As long as I've been shadowing with him, I'm still getting new pearls of wisdom. So it's awesome information. Thank you. I'm honored to be working side by side with Dr. Ferris because he is a double board certified physician. He has over 30 years of experience in emergency medicine. And he is also board certified in anti-aging medicine. So I also like hanging out with him for those reasons. I'm always picking his brain on that. Tonight, we want to do a special focus on our topic, are you sick and tired of being sick and tired? And the reason we picked that topic is this is just the common theme we see when people are coming through our doors. Whether it's brain fog, fatigue, low muscle mass, you name it. But one of the top ones that we see that's usually a part of every piece is this struggle with weight loss. So, so tonight we're going to be, well, not me, Dr. Ferris is going to be addressing.
There'll be plenty involved.
I'll be trying to stay quiet, but Dr. Ferris will be talking about why this might be happening and also talking about some solutions. So I asked to make this interactive. I'm glad that our chat is working. So if you do have questions, send some questions through. I'll be paying attention to those questions and I can share them with Dr. Ferris. I also have had some questions come in previously. So as Dr. Ferris is talking, I'll pop those in as we go along. Sound good? Awesome. So, all right, I am going to zip it for now and let Dr.
You're not going to zip it, so I'll just speak for a little while. Well, welcome everybody. Thank you for joining us. We will hopefully hit on some really pertinent, salient information that you might find advantageous as you embark on this health journey that we are all on, right? And you know, when patients come to see us, like Angela was talking about, one of the most resounding things we hear over and over is, I'm tired. I just struggle to get out of bed. I've got 2 good hours in the morning. I make it through lunch and, you know, I'm dead after that. Or it takes me 3 energy drinks. I have to have 4 coffees, whatever, just to keep going. And so the question now becomes, well, how did I get into this chronic fatigue state, right? And we're going to try to explore how you got there, right? Because when you understand how you got there, then we can start to get into the solution phase and start to investigate the solution, because it's usually more than one thing. So again, we're all fatigued. You know, I've been a clinical doctor forever. I've been, you know, I always tell people, the one thing I'm an expert in is the loss of sleep.
Unfortunately.
Right. So I get being tired. I know what it's like to work 16 hours a day. I know what you're experiencing. And then we're going to start to jump into this and see why it is and see if we can offer you some solutions. So let's get going.
Do you want me to share the?
We'll go to that in a minute.
Oh, okay,
right?
perfect.
Let's just preface this and understand how we got here, right? Well, again, what ends up happening is we're all doing pretty well in our 20s. We finish college or whatever we do. We're youthful. We have great hormone levels. We're vibrant. We're active. We're invincible, right? How many people have said, well, when I'm in the 20s, I'm like invincible, right? You hear the guys that I could work all day, party all night and do it again. And now it's like, there's no way I'm doing that, right? So what happens between age 20 and age 40, 45 how does this all manifest itself, so to speak, right? So we live life, right? We live life hard. We live We start to have dietary indiscretion, we stay out all night, we party too much, we imbibe alcohol, we might use other substances, we start to gain weight. All these things start to be contributory. Then the males actually have it pretty easy because we don't go through childbirth. The women have it much tougher because now they're going to go through childbirth and go through this hormonal fluctuation that is just astounding, right? Which is a major contributing factor to why women can't lose weight. I mean, especially if you're a breastfeeding mother, I mean, that is nature's way of keeping the child healthy, is to keep a little weight on you. So again, you're trying to fight against nature, and nature wants to do what it wants to do. So now you arrive at, let's say, age 40. I mean, it could happen earlier than that. And you wake up one morning, you're like, I'm really unhappy with the way I look. I'm really unhappy with the way I feel. And how did I get here, right? And now you're looking for answers. And there's tons of information out there. We live in a data-driven world. The question is, are you deciphering the right information for you? Because everybody is different. And this is what you learn when you get old. And you, as she says, I have wisdom. When you've seen thousands and thousands of patients, you realize no two are the same. So you can't treat them all the same way. So now we've got 10, 15 years of what we call metabolic dysregulation. Your metabolism is slowed down. Your diet has gotten poor. You put on some weight, which has now created a bigger problem. You start to get inflamed. You get this idea of inflammation, which is building on itself. So all of these things in your body that we talk about, these regulatory pathways and things that make you run, are now getting sluggish. And my analogy for most people is that by the time you hit 40, it's like driving in rush hour traffic. Your body is not going to really move quickly through that because all this stuff is now inefficient. So we have to try to get your body working efficiently again. Your body is expending so much energy just to do the day-to-day things because you're inefficient. What the underlying metabolism, the hormones are all, they're fighting, they're working so hard because they can't find the freeway. So our goal is to, how do we get you out of the 5 p.m. traffic and get you feeling and moving into the 5 a.m. traffic, right? Where there's clear sailing, right? There's nobody on the highway. Even if I get off the interstate, I can jump right back on, right? And this is what we'll talk about tonight, is that when you have dysregulation, when things are inflamed, you get off the highway, you get off your program, it's really hard to get back on. So this is where it takes motivation and fortitude and coaching and a good program that's all encompassing to help you get back there. Okay.
And I would just want to add, because what we do here a lot is, I used to be able to lose weight real easily when I was in my 20s. Now I'm in my 40s or my 50s, and this weight will not go away. And as a dietitian, typically we are taught, well, just teach them to eat less and move more. And you are Sharon, and I have seen this. This is so true. That's a piece.
That is a definite piece.
But there is so much more to the puzzle as opposed to just eat less, move more.
Okay, so let's pull up the puzzle.
Okay.
Right. And let's talk about the puzzle.
All right, hold on one second. Let's just pull up that puzzle. So give me a second to pull. Oh, no.
Most excuses, we
There-
tend to be technologically challenged.
Yeah, we are not the most, let me do this. Share. Nope. Hold on.
And you did this earlier really well.
Stop sharing. I'm trying to figure out where it went. Hold on a second. Nope, that won't do that. Darn it. All right. Well, you're gonna have to keep on talking, Dr. Ferris, and
All right.
I'll have to try to figure it out, because
All right.
we have a really pretty wheel to
It
show.
really makes a lot of sense when you see it. We're hopefully, again, I can show you the paper version, but you'll laugh at me because
Yeah.
that's kind of how I do things,
All
right?
right. I'll try to play around with this, and don't let
So-
me distract you.
Let's just take the typical person, right? I'm 40-ish years of age, you know, and okay, let's pick a woman because y'all are harder, right? And you've had 2 children, you're a mom, you got 2 kids in school, you're basically our bread and butter patient, is what we see right now, okay? And you're wondering, like, you know, I'm 40 and I really want to start looking better, right? I've done some of the hard work. How do I get there? And you go to your doctor or your primary doctor, and he says, you just need to, we've heard this already, you need to exercise more and you need to eat less, right? And those are not wrong statements, right? But how do you take someone who struggles already, calorie restrict them, and then make them exercise more? That is a very, very difficult thing to accomplish, right? Because people get too far calorie restricted, then they don't have enough energy to do some minor exercise. So when you start to look at the problem, I'm not going to say exercise is not beneficial, because it absolutely is. And I'm not going to say diet is not beneficial, because it absolutely is. It's probably the most critical piece. But without proper guidance, this is a struggle. I see a gentleman yesterday, he's 100 pounds overweight, right? Before he comes to see me, he says, I'm gonna do this weight loss thing. So he's 300 and something pounds and he's restricting himself to 1,200 calories. Well, he's probably 1,800 calories a day deficient from what his norm is. So let's just take it down and say what he basically needs is about 2,000 or more, and he's that deficient. He said, it got to the point where I couldn't even function, right? Because he had put himself in such a calorie deficit that he struggled with energy, right? Mm-hmm. So we're not going to talk about, not going to say that getting people into a calorie deficient state is not a positive thing. You just have to be careful with it, right? Right. So now I have to bring this up because it's so timely, right? We got to talk about the drug, right? I mean, everybody's
he's talking about.
Everybody's waiting for this one, right? All right.
And we're bringing this up because this was like a question that came in multiple times, and we hear it constantly.
In the last 3 years, 2 major drugs have come onto the market. The first one, and I'm going to use the long name, which is semaglutide, also known as Ozempic if it's a diabetic drug, and Wegovy if we're using it for weight loss. And the other one is tirzepatide, which is also known as Mounjaro. These are fabulous drugs. These are drugs of a generation if used correctly, okay? Because the way they work is they basically tell your brain, I'm not hungry anymore, so I don't eat. So you're forced into a calorie restricted state because you have no appetite. Plus it does some other things on the pancreas and insulin production. So these things are magnificent drugs, and you're reading these success stories. These people are losing 80 and 100 pounds. And I'm like, this stuff really works. And when you look at the science, this is a groundbreaking drug. I mean, it is the drug of a generation. Okay.
And it's not a stimulant like some of the ones.
Not a stimulant. If you can get through the nausea, I mean, you can really win on this drug. Okay. Now, we know this drug works. Unquestionably, the data is there. Okay. But we have to be careful in how we use it, because now we're starting to see the side effects of using these drugs. More commonly, we're seeing more effects with the semaglutide, and these people are being so calorie restricted. Yes, they're losing a ton of weight and they're losing a ton of fat, but they're also losing a ton of muscle. So you start to hear about this term where they get this gaunt face and they have to go get filler because they're losing structure of the body in addition to that, to the weight. We want to lose fat. We do not ever want to lose muscle.
Yeah.
Okay. So these drugs need to be done under the guidance. This should not be done in some semaglutide clinic, which
are popping up
left
and right. Yes.
Right. Because we need, in my mind, you need to know how to get somebody on this drug. More importantly, you need to know how to get somebody off this drug, right? Because if you ask the drug makers, they want you on it for a lifetime. And if you're on a lifetime of these drugs, you have a second mortgage. they're that expensive.
Yeah.
Okay, so science is there. These drugs do work. They really need to be used carefully. And again, the other question you have to ask is, if we don't teach you how to manage your life while you're on the semaglutide or Mounjaro or tirzepatide, what happens when you go off? You know, this is the same thing we saw in other weight loss areas, is that as soon as you stopped it, weight came back because you were not prepared to deal with life on life's terms when now I have an appetite.
Which is where I do want to give us a plug in the fact that we do have some clients who have been using it, like Dr. Ferris said, they've been very successful. But we are working with them also on those lifestyle changes. We're working with them on all the other factors so that when they do get off of this drug, the goal is they have now a new lifestyle, they have new habits, and they can keep this weight off.
I mean, the most frustrating thing for a patient is if you spend $10,000, which is not uncommon, on one of these drugs, and you lose weight and gain it all back, you're going to be really frustrated. Okay, so these drugs do have a place. We believe these drugs have a great potential, definitely need to be used correctly. Okay.
So, and I would say they have to be used correctly, they have to be monitored properly, and that is what I feel we do best, because we have seen people get their hands on this kind of the wrong way, they're using it the wrong way, and that can be detrimental.
Right. So again, not against the drug, really needs to be used with the assistance of either a nutritionist or a medical professional that understands how to do this. Okay, so we'll leave the semaglutide. I know there'll be questions about it, or the tirzepatide. Again, if used correctly, wonderful. Okay, let's jump to the other end of the spectrum, which is exercise. The body has to move. Okay, but why not just walk? Why not start somebody slowly and work our way up? We know we're going to need some resistance training, but far too often people have so much motivation, they go and get a trainer and they get beat up, right? Because they put them through a CrossFit workout or a P90X type workout, and like after 3 days, I can't even lift my arms. So again, if you've not been physically active, you need to acclimate to physical activity. I saw a lady, she was well over 350 pounds, and she says, what can I do for exercise? I said, walk 100 feet every day. And then when you can do that, walk 200 feet.
Yeah, you've got to be
Right?
realistic.
You can't send her into a gym, again, for many reasons. So again, if you are going to pursue that, again, have patience. As you get better, as you get stronger, then we could increase some of the things we do. All right, so that's diet and exercise.
I'm going to interrupt real quick. I've been told if you can't send a chat question, send it through the Q&A. I just wanted to let everybody know that. So
All
I've
right.
gotten a couple texts.
Any luck on my wheel yet? No?
Well, no,
Okay.
because it's saying unless Rick can text me, it's saying I can't minimize while I'm.
All right, well, anyway, so let's start to look at other factors that could be contributory to why you're struggling, right? The next big area is the area of food addiction. What do you mean food addiction? Doc, what are you talking about? I mean, I'm not addicted to food. And I would tell you, be careful on that statement, right? I used to love diet sodas. I was addicted to diet sodas, right? And understand that diet sodas, even though they have no sugar, are highly addicting and also create an insulin reaction. The point is, these companies all have psychologists on staff that are trying to figure out how you will buy their product. And once they get you, they're stimulating an area of the brain that is right there with addiction. Sugar is as addicting as cocaine. If you don't think that, look at the research on it. So understand you may have food addiction, right? I mean, it's more common, and all we're trying to do is make an awareness is, do I have something like that, right? Because nobody wants to pass up really good tasting food, right? I mean, who's going to pass up a Krispy Kreme that's hot?
I do think the manufacturers are that is their goal. They want us to keep coming back for more, and they have
Absolutely.
created.
They have psychologists. They know, and even if you go to the grocery, I mean, they place things right at eye level for you to buy them, right? The
So,
healthy stuff is not at eye level. You have to dig for it.
yeah, and I think becoming aware of that, and again, that's all about lifestyle change and awareness. That's where our coaching comes in handy when we're working with our clients, is creating an awareness of this and then come up with a game plan and working through it. But it's so important to make sure that we are aware of some of these things that might be keeping us stuck.
Right. So, again, there are certain things in life we all like. You just have to start to do the work in your own mind. Is this something I can live without? Or is this something that, do I just like it, or do I just want it every day of my life? Right.
Yeah, absolutely.
So just be aware. And again, this is where a good coach, a good nutritionist can help you identify this, because trying to break someone of a food addiction is not easy. It takes time. So it takes coaching. It's not just, oh, I'm going to turkey it,
Yeah, it's not just.
because that's fair.
Yeah, I always say it's not willpower, it's skill power, and let us teach you the skill power to get through some of these challenges.
Right. So here's a whole new area that maybe we didn't consider. Let's go to another area, okay? And this is my world. This is medications, right? Too many people are on too many medications, and there's many medications, especially in the antidepressant world, or SSRIs, that have been shown to increase weight. And how many, and unfortunately, because the way the medical system works now, nobody listens to their patients, they just write scripts. And as soon as you get put on an SSRI for whatever reason, it becomes, after 30 days, you're hooked on it. I mean, it's just like a drug. It is a drug. So these things have been known to put weight on, and beta blockers, certain other medications are known to have an effect on metabolism and have an effect on the brain, where we become a victim of the medication. So again, I'm not telling you to stop your medications. Again, I'm just exploring areas that as we get you better, we may try to wean you off these medications, because this may be one of the chains that you need to break to get you to the other side.
And so I'm just going to interject on that, because I notice, we see this again, it's a pattern. A lot of people are coming in. Maybe you've seen some of the posts that I've made, but women are seeing their primaries and saying that they're tired, they're in a funk, they've gained some weight, they don't know why. Well, they're menopausal or so, but they're getting prescribed these medications. And then these medications sometimes cause more harm than they do good. And then we just kind of spiral. Maybe they end up on yet another medication. So
we're down the rabbit hole now.
Yes.
Again, we're just trying to give you an awareness that it's more than diet and exercise, right? And we've only hit 4 things, and we've got some more to go.
So diet, exercise, definitely a component. We have to consider food addiction, so our eating habits, and then we have to consider medications. So we've got lots of things. So then go ahead and.
So the next big area, and especially this is for many of our people that are into that mature age, right? I like mature. I'm much older than mature now. So is this world of hormonal dysregulation or hormonal imbalance. It is so common, and it is really not looked at. I mean, it's always amazing to me that new clients come in and they go to their doctor and they can't find anything wrong with them. And we run a sequence of tests and they're like, thank God you found something wrong with me. And it's just because we looked in the right place, right? So hormonal imbalance is a huge factor, which could be contributory to why you're gaining weight. And not only that, why I can't lose weight. So let's explore that just a bit, right? We continue to see the concept of clinical hypothyroidism. And what I mean by that is I have a male or a female who has fairly normal labs, because the range of thyroid is like from here to Statesville, okay? And that's about 50 miles up the road. But anyway, And the doctor says, well, you're in range. Well, again, being in range is not optimal, right? So we see women who have symptoms of hypothyroidism, yet have normal labs. We put them on thyroid medication and it changes their life. Okay, so that's just one area. The next one is cortisol. And I will tell you, this is the big pearl for the night. If your cortisol is dysregulated, you will struggle.
Mhm.
Your cortisol is dysregulated, you will struggle. Cortisol is a stress hormone and it causes storage and it'll put fat on you. And we just fight this one tooth and nail because we live in this stressful society and we don't sleep right and all this thing contributes. So we check cortisol. We believe in this idea of what's called the HPA axis. We treat the HPA axis very aggressively and we see resolution of a lot of problems.
And I want to add that the way that we track the cortisol is either through saliva and or urine. Typically, if somebody does, if a physician will track somebody, it's just through blood serum, and that's not accurate. So
Because it changes during the day.
Yeah, it changes all throughout the day. So if you really want to get an accurate idea of where your cortisol is, we take a look at your cortisol curve. And by looking at that, we get this better idea. Are you high, and are you high all throughout the day? Are you just flatlined? Or are you going up and then going down? And then Dr. Ferris knows how to do his magic and
So
help.
magic is just clinical medicine. It's not magic, it's clinical medicine, right?
But by tweaking that and making those adjustments, you're so correct. I mean, then we do have people are no longer sick and tired of being sick and tired. I mean,
Right, if you're hypothyroid, you're gonna be tired, right?
Yes.
Your cortisol is dysregulated, you're gonna be tired, right? And we haven't even jumped into the real good topic, which is the whole sex hormone thing, right? Because what women need to understand is on or about the age of 36, 37, 38, you start to go into potential perimenopause, which means you start to suffer hormonal decline. The first one to go is progesterone, then testosterone, and then estrogen, usually in your 40s. So that as you start to get this hormonal decline, your body's still clamoring that I need things, right? Because we have hormone receptors for these outside of our breast and our ovaries and our uterus, and for men outside our testicles. So we have to start to consider, is this contributory, right, to the problem, right? I got a little story on this one,
I was
right?
going to say, make sure you share this one.
So
This one just happened.
this one just happened, right? So I see a patient comes to see me, and she's 61 years of age, otherwise healthy. And she says, my daughter's getting married in May, and you have to make me look good for the wedding. And, I'm like, right? Because now the pressure's on, because I know what this woman wants to look spectacular when her daughter gets married. And it's like, failure is not an option on this thing, right? And she's like, I've been at this for so many months, I'm not successful. And so I finally came to you. I said, okay. Then we looked at her hormones, right? We put her on thyroid, we put her on progesterone, we put her on testosterone, we put her on some estrogen, right? And I see her and she goes, I'm 2 pounds from my goal weight.
And this was
And
just
she's almost in tears, right? And she goes, but that's not it. I feel so much better. My hair quit falling out. I'm sleeping. My skin looks good. I have joy of life again. And she's like astounded, right? Because I didn't tell her this. My goal was, how do I get you looking good in the dress? And she goes, I never in my wildest dreams thought I was going to get what I came in for.
And that was yesterday morning, or
Yeah,
was that this
it's
morning? That's
amazing.
right, 'cause I remember
Just amazing.
and you walked her up and you're like, she didn't get what she wanted. And then at first I was like, oh no. And it's like, she got 10 times more. And I was like,
And that was her statement. It wasn't mine.
yeah, that's right.
And all we did was balance this woman's hormones. And balancing this woman's hormones was one of the tickets to get her, and she's going to look amazing on that wedding day.
And she's gonna, and like you said, on top of that, feel good, have her confidence, she'll be shining. So that is a fun story. I love.
Right.
That was
Let me
awesome.
tell you another quick snippet, right? I do take care of some athletes, right? And I can't divulge too much, but this guy is basically a professional athlete. He's 37 years of age. He comes in and this guy is chiseled out of granite, right? He looks like any professional athlete you can. We check his testosterone, and his testosterone is below the normal range of a male. And you're like, what? And I look back, and the only reason I know about this is because it happened to me, because I was an endurance athlete, and that's how this thing can happen. But it's just amazing that you look at people and you say, well, man, he would have a testosterone of 1,000 and he didn't. So again, if we don't look under the hood, we don't discover the imbalance and we can't fix it. So again, we could talk about hormones for hours and we're not here to just discuss that. But again, something to consider if you're struggling, and especially if you're struggling at age 37 or above, because hormone restoration could be key.
And we always say we prefer to test, not guess, because that's going to get us to that end line a lot quicker because we know what we're working with.
Right.
So that's why we love the testing that we offer for the hormones.
Right.
And all right, so now hormones is another thing to consider when we're sick and tired of being sick and tired, struggling with some weight. Talk about the next component.
So the next one I want to talk about is the GI tract, or what we call the gut. All the really good clinical research in the last 30 years, in my mind, has come, one, in the world of genetics and genomics, which we won't talk about tonight. That's genetic expression. And two, it's on how they found how important gut health is to your health. And too many people have gut problems that have gone unrecognized. Okay. This is the concept of leaky gut or dysbiosis, or, you know, what we see a lot of. I have irritable bowel, right? I'm gonna let you in on a little secret. You know what irritable bowel is? That means the doctor doesn't know what's wrong with you. So he's going to call it something so he can get paid.
Mm-hmm.
So I'm not saying irritable bowel is not a real disease, but there's a root cause that somebody needs to look at. If we do not have a healthy gut lining and we do not have a healthy, what's called microbiome, we do not have healthy immunity. We do not have healthy neurotransmitters. We do not have a healthy heart. These things are paramount. So we really delve into gut health. You come to see us at some point, we are going to work on your gut, because the gut is now being considered the second brain. It communicates directly with the brain, so that if we're not working on gut health, we're not doing you the correct service. When we start to correct gut-related problems, people get better. And of course, I hear it all the time. Well, I had a colonoscopy and it was normal. And I had an endoscopy and it was normal. And I'm like, yeah. The problem is the function. They're not looking at the function, they're looking at the anatomy. Okay. We want to look at the function. How well does it function? Are things getting through that lining and creating an immune reaction, and that causing autoimmunity? So it's a very, very dynamic process. So anything we can do to improve your gut health improves your brain health, your immunity. It's just so paramount. So if you want to get healthy and you want to do nothing else, improve your gut health.
Yeah, and again, this is an interesting topic because in dietitian school, this is not taught. So this was something that my group of dietitians, we've all had to be aggressively learning over the last few years, because it really is the core. And again, that is another aha. So if somebody's coming in, they're struggling, they've tried different things, we have to look at the gut, and we have to look to see, are you regular, and what does regular mean for one person as opposed to another? So we have to do some probing, because some people think regular is going once every 5 days.
No,
That's not regular. So, but if you do have some gut challenges and you're not addressing them, or your provider's not addressing them, that very well could also be what is preventing you from hitting your goals.
right. Again, another little snippet of a story. We have a patient struggled most of her life with weight, and we put her on, we use a cleanse. So a cleanse is sort of a mild way of jump starting in. We learn a lot of information when we do these cleanses. They last 1 week. It's a tough couple days, but it's well worth it. She does the cleanse, she loses 8 pounds. Wow. She does the cleanse again. She loses 6 more pounds. So we start to do this cleanse once a month over and over, and this lady has lost 50 or 60 pounds. We didn't give her a medication, right? We didn't use anything spectacular. We didn't do any head shrinking. We didn't do anything magical other than to give her a cleanse, which cleaned up her gut, made her healthier, and all of a sudden weight falls off, and she's like, I can't believe this.
That was a game changer. And
Game changer.
It was huge and it was very exciting. And again, she was a great example of somebody who was pretty much doing a lot of everything of the
Tried everything.
Yep, the basics.
Done everything. HCG, phentermine, you name it. We've done it all.
Yes, and then Dr. Ferris got her on this cleanse, and then, I mean, the results were just amazing. And then since then, I mean, we were always using it prior, but I think we've all in the practice been suggesting that much more.
Again, great for us. It's a tremendous diagnostic tool. We try to get everybody to at least consider it, because how well you do on that cleanse dictates how sick you are.
Yeah.
If you're losing 6 to 8 pounds, we got a lot of work to do. You only lose 2, then okay.
Yeah.
We don't have as much work to do. So if we can use it not only as a diagnostic tool for me and for Angela, but also a therapeutic tool. So cleansing, another area to be considered, just again, make the gut healthier.
Yeah, we try to recommend that to a lot of our clients coming in, getting started on the hormone program. We found that just doing that for a good week gets their body straight, helps clean them up, and then their body's able to receive those hormones that much better. So lots of success.
So gut health, paramount to your health. You do nothing else, work on your gut, right? You don't have to do a lot of magic, just clean up your gut, right? But again, that's diet, that's many things, all right? All right, now I'm going to move into an area that I actually gave a big talk on last week on a national basis. And it's the world of what we call obesogens and toxins. Oh, doc, I don't want to hear about this now. I really don't want to hear about this. And I'm going to tell you, you need to hear about this because it's there, okay? And what I want to do is at least give you the information to set the stage about what I'm going to talk about, right? So the Centers for Disease Control, or the CDC, last looked at this in 2009, and they basically checked blood and urine and hair on a bunch of people. They found 212 different chemicals in the human body, over 70 of which had never been seen before. That's in 2009. You think we're better now in 2023? I would say no, right? We're exposed to plastics, we're exposed to solvents, we're exposed to mold, we're exposed to paint thinners and glyphosate and pesticides, and
Even our skincare products
it's
and our
just-
makeup products.
there was actually a study that said, it looked at that by the time most professional women walk out of their door, they've been exposed to 80 chemicals. By the time they've showered with and put things in their hair, by the time they put on makeup, cleansed, perfumes, etc., because all perfumes have solvents, which are volatile organic compounds. So again, they are out there, right? So we have to start to be aware of this, because when you get a toxic load, your body is smart. It's not going to let them go to your brain. It's not going to let them go to your heart. It's not going to let them go to your kidneys, right? It's going to wall them off. How does it wall them off? It walls them off in fat. That's why fat is inflammatory, right?
I want to make sure this soaks in with everybody, because I just am fascinated by this. This is such a big part of the weight challenge sometimes.
Right. I always tell the story. I mean, we used to have a nice piece of property, and we had weeds everywhere. My wife would walk out with double, roundups, right? Now, come on, folks. We all know we've been there. We have all had a Roundup can, and
I told my husband I was going to divorce him if he didn't get that stuff out of our house.
But, and again, we have to be aware of this, because, glyphosate and these pesticides are fat soluble, which means, and they bind irreversibly, which means once they get in you, it's really hard for even in the best hands to eradicate them. So now we've created an inflammatory reaction. We've created a fat depot, and you keep getting exposed, and you can see where this is going, right? All right. So I'm not going to sit here and bore you with all the details. Let's just say we are exposed to toxins. So what do we do about it? The most simple thing is I need to pee, I need to poop, and I need to sweat. Now, we can go much further than that, but I just want to give you this awareness that maybe toxic exposure is on your list. Maybe. Think about it. Okay.
Didn't we have a client, she was a while back, but we were trying to work with her on weight loss, and we discovered she was brought up by a coal mine, right?
Coal mine, right? Exactly. All the
And-
toxins of in the water. I mean, it was like, oh my God, how am I going to fix this woman? Right? Because
So it's something to consider. I mean, where were you brought up? Where are your surroundings now? What have you been exposed to? There is a test, we don't run it often, but there is called total toxic overload, but it runs and it will test for every chemical in the world. I was exposed to the BPA and I was offended because I try so hard to stay away from that, but it still sneaks in.
right. I have one. You know,
Oh, is it BPA free?
I don't even know if it is.
And I don't even trust it.
But I mean, how
doesn't-
many?
right.
How many? All the
Shouldn't have
time,
that
right? I'm
bad.
guilty.
That,
So I'm just. The point is, we're human, and because we're human, we're gonna get exposure, right? So just again, it's another thing of, is that one of the chains that's on me that's stopping me from looking and feeling the way I do? She's been through a detox, I've been through a detox. They're not easy, but oh my God, when you get on the other side, it's pretty amazing.
yeah,
They are not easy. I'm not
No.
going to walk you into that lightly. That is a major undertaking.
it's a big commitment. But if you're sick and tired of being sick and tired, which is actually the topic of this, sometimes that is something to consider. So
Absolutely.
that's very important. But I mean, that clicked for me as I've been working with Dr. Ferris on how that ties in that and holds into the fat cells. And so if you're struggling, trying to lose some weight, that is absolutely something to consider and things that we like to dig into.
All right. So that's number 7, right?
He did pull out his, I mean, because I can't pull up the screen for some reason. So this is his cute little map, but it looked nicer, the one that our marketing lady did for us. But
so we're going to move into the last area, and that's the world of, what we've been talking about is this metabolic dysregulation, or is you have a slow metabolism? Do you have inflammation, or is it just your lifestyle, right? Do I, again, and this is a big multifactorial. Am I under too much stress? Do I drink too much alcohol? Am I sleep deprived, right? All the things of how we live life can contribute to this, right? I mean, I've been an ER doctor for a very long time. I'm finally going to get to retire. I am still amazed at what everybody in healthcare eats. It's pretty scary,
yeah.
right? Because there's nothing available on night shift, right? And then you take a night shift worker who completely, they don't sleep well. They live on caffeine and stimulants, right? So all these things need to be considered, right? So again, the biggest area we really want to work on that is that, can you just have like one drink, right? Can you consider dropping certain things that could be negative to your life? And then we really want to focus on sleep. We live in one of the most sleep deprived countries of the world, and we should.
Yeah,
Right?
you're right.
So lifestyle and how we live our life and what we do, right? And again, my story on this one is I've got a very, very good friend. Known him, I raced against him for years, runs a extremely successful personal training up in Cornelius. Matt, if you're on, kudos. We used to hear it all the time. He goes, I have all these clients, they work out really, really hard 5 days a week and they can't lose weight. And it finally uncovered that they were all living out on the point in all the nice places, and they were out in their boats and drinking, thousands of calories of alcohol on the weekend. And then getting into the Bojangles, right? Right, because There's nothing better than alcohol and, some
Little bit of
Bojangles
grease,
or,
little bit of grease.
right? So they were undoing all their good work in 2 days. So 5 days of work, 2 days of undoing, stagnant.
Mhm.
Right? So again, we have to consider lifestyle. If you want to be successful, this is a commitment. As you get better, the commitment becomes a little bit easier. But remember, when at least in the beginning, we really got to work hard to get you over the top. Because once you start feeling better, you're motivated. And that's the hardest thing, is when you're not feeling well, you're asking me, how am I going to do all this? You're going to do this because you're going to have people that are going to answer your questions and coach you and motivate you and be in your, you've got to have somebody and you got to have an accountability partner beside yourself.
And that's where I feel we are very strong, because we have an amazing team. We've got multiple locations, but we've got a very passionate team. So myself, Dr. Ferris, the 20 others are very committed to working with clients coming in and kind of trying to uncover some of these challenges that are going on. But the real complicated ones, we push this way. So that's the nice thing, though, is like we do have our, we work very in sequence together, because there's a point where even
We're a
us,
team. I mean,
yeah,
that's how you win.
dietitians, our expertise ends, and we need to bring Dr. Ferris in and all that good stuff.
Right. And so, I mean, at this point, I've sort of completed my wheel of 8. I wanted to keep it simple. I mean, I could have made this much more complicated, but the goal for tonight was to bring some awareness that now you might understand why you're struggling, because it is more than diet and exercise. Can we consider other things? Do we need to look at your hormones? Do we need to look at your lifestyle? Do you have food addictions? Can we get you off medications, right? Can we fix your gut, right?
Do we have to look at this toxic consideration?
Right, so when we're not going to do all those at one time, we're going to try to pick 1 or 2 things and work on that, because trying to tackle all 8 of them is too hard.
Right.
So hopefully that we have given you a little bit of awareness of why you're frustrated. So we get it. And we want you to be healthy. There's nothing more important than your health. Don't spend your whole, as I've heard from many patients, I spent the first half of my life building wealth, and now I'm going to have to take all of my wealth to get my health back. Try not to fall in that category. All right. We got to we have to, as clinicians and dietitians, look outside the box. We got to get out of the teeny tiny box and start to look. Why are you struggling? Can we help you? Because when you start to feel good, the smile comes back, the life comes back in you. And then suddenly you're like, I'm not so tired anymore. Right. And that's the goal, because you're sick and tired of being sick and tired. So,
yeah, it's. I just wanted to know, I know we've got like 9 minutes, and I wanted to be able to address 2 quick questions. I think you answered most of them. One question that I got a couple of different times, I did want to just try to quickly.
sure.
Intermittent fasting. I've had a question on intermittent fast.
Intermittent fasting, time restricted eating, probably one of the greatest things you can do, especially if you look at the world of longevity, living a long time, living well. Understand that as a civilization, we've been fasting for 30,000 years. It's only in the last 100 years we haven't fasted. Again, it's mentioned in the Bible. It's mentioned over and over. The work was done at the University of Southern California School of Medicine. So this is real research. I always tell everybody it should have won the Nobel Prize. It's that important. But we just talk about time restricted eating. 16 hours of fast, 8 hours of feeding window. You're still getting calories. So if you could be open to that, that can be very successful. We see lots of women that want to extend that and go to what we call OMAD, 1 meal a day. That's a 20-hour fast and a 4-hour feeding window. But this can be extraordinarily important as an adjunct, because again, your body and your brain cannot repair itself in a fed state. So when you get fasted, we're now getting some repair going on. We're getting some things. We're trying to get that metabolism going again. All right. So fasting is a beautiful concept. You just got to get over the idea I'm hungry.
And I'm gonna say, you want to make sure it's fit for the right person. We're not wanting to implement this with somebody who's got an eating disorder or some disordered eating. So again, I think it's important that if you're going to approach this or look into it, that you are working with professionals who can help guide and monitor it, make sure that you are doing it the proper way. There's also modified fasting, like if the 16-8 was too
Again,
much.
we tried 12, 14.
Yeah.
We try to work with you, but we know the concept of fasting has extraordinarily good clinical science. Okay. This is not bro science. This is not TikTok science. This is real science.
And nobody goes with, nobody's allows, people are grazing all day long. And
Food
again,
availability.
it's interesting in dietitian school, we are taught to teach people to eat small frequent meals throughout the day. But as we get older, over the age of 40 in particular, we kind of have to do the reverse and allow our body more recovery time, more fasting time.
Correct. 100%.
So again, this goes to show when we're working with individuals, we're taking into consideration their age and where are they at and what are their struggles. There's a lot of misinformation out there, and we take a lot of pride to be able to guide somebody after we properly assess them and guide them the right way. So that was the question. And then with just a few minutes left, you have to mention this cool study that you said has so fresh that hasn't even been published.
Yeah, it hasn't been published.
Are you allowed to mention it?
Yeah, I can mention it because it came out.
And it's from a good source.
So this is from Mayo Clinic, and Mayo Clinic is about as respected of a clinic there is in the world, right? They looked at menopause and the cost of menopause, right? Because when women have menopause or hormonal dysregulation and they don't feel well, they miss work and they're less than productive. In this study, okay, the cost, because they looked at several thousand women, but then they tried to draw a conclusion based on 15 million working women that the cost to the economy is $1.8 billion due to menopause, which is just an astounding number. And we just sit there and go, well, grandma went through it. You should go through it. And I'm like, no,
Yeah.
right? There's a solution. Why are we not doing the solution? We've got good clinical data that we can do this safely. And my God, $1.8 billion. It just astounded me. And I just saw that this afternoon.
Yesterday, you shared it.
It's not even published yet.
And I thought that was interesting because I'm thinking, okay, huge effect on the workforce. And we're always talking about how menopause can affect the household, right? If mama's not happy, no one's happy. But then we're also seeing, it is affecting the economy because women are calling out sick. They don't feel good. Production is lost. So I thought that was pretty helpful.
Again, when they really start to work this study, I think it's going to be very interesting. And I think more people need to have this awareness that when you get your hormones back, you can really thrive in 40s, 50s, 60s and beyond.
Yeah, absolutely. So, well, I know I got through my questions. I know that we're about out of time. Let me see. I have one more. What options do I have if I have a blood clotting disorder and been told HRT is not an option for me? I'm 50 postpartum.
So that's a great question. Okay. Now, remember that most clotting, at least in that, is due to oral, right? There's a little bit less risk with transdermals, right? But I'm not going to say that you're devoid of risk. And again, what we do in that case is we try to assess risk-benefit ratios, okay? If we're going to pursue this, we're going to do it the lowest dose of hormone possible, and we're going to assess you frequently. Again, part of clotting is sedentary lifestyle. So we would, for someone like this, we would be paramount for you to get up and move and walk. And then again, most people who have a clotting disorder are already on medication. So it's not an absolute no, but it's a very careful yes.
And that would be part of what our goal would be, is properly assessing each individual when they come in to see where they're at, to see if they are a candidate for the program. And then like Dr. Ferris said, that's where we are our strongest. Then if they are, we monitor them and we test and we monitor, and that's part of what they're receiving.
Right, because this is more than a clotting disorder. This is lifestyle, and what can we do to prevent that clotting disorder to manifest itself?
So that was a great question.
Great question.
So,
Very, very hard one.
all right, well, I think we got through all of the answers or all the questions. So hopefully we answered them all. Certainly appreciate everybody calling in and listening, and I hope you got some great information. Again, I'm always picking up new information. Please, if you've got questions, if you'd like to come in and see us, please reach out to us. You can email us info@tntgetfit.com, info@tntgetfit.com. Hopefully, if you've gotten this information, you have the contact information, but we'd love to help you. If you got any other questions, please reach out. We are here for you. And we will be back with more of these fun webinars.
And remember, your health is the most important investment you can make.
Yeah, that's right. So this is the only body we've got. So we got to make the most out of it. So thank you so much. And y'all have a great evening.